This is my presentation called Kauai Preschool Oral Health and Educational Approach. I created an educational program for preschool-aged children on the island of Kauai in the city of Kapaa. I was able to introduce them to fundamental hygiene practices, evaluated what they already knew. I gave them instruction on oral care and talked about what the dentist and the hygienist do, and I was able to integrate things that they were already learning and build up on those. And what was really cool is I was able to address challenges that they face when it comes to maintaining adequate oral hygiene because they have very limited education when it comes to schooling. The area of interest for me, I'm from Hawaii, so I realized that when I was in school, we never had any programs like this. It's a very unique environment when you're in Hawaii because it's isolated for many people, and it's a really unique island community so that they've been suffering because they don't have as many resources as other places do. And it is really important to me because I was able to see and learn that in 2019, a study was shown that early childhood caries is still the most chronic disease found in children worldwide, and that is very scary. The location of Kauai Keiki Smiles was a school-based program that took place at Kapaa Elementary School. I did it in Kapaa in the state of Hawaii, and it was a week-long program. We did 30 to 45-minute sessions each day just to spread it out so we could keep their attention and then build up each day and focus on different topics so that they could get a full curriculum and learn a lot of fun stuff. So some demographics about Kapaa, which is 96746 is their zip code, is that there are 27 dental offices that accept Medicaid or dental Medicaid within a 25-mile radius of Kapaa. And of those, there are only 6 dental offices that are accepting new patients. So if someone needs an office to go to, their options are very limited. I even researched to go further in depth, and that I looked into what offices are taking pediatric patients, and there's only one dental office, and that is not enough to help all the people that need to get dental care. Here are some statistics that show you how important it is to have this curriculum within the elementary school. So it's about 49% female, 51 male. They are free and reduced lunch program school, so they are low income. And ethnicities, you have a pretty good mix, but majority of the students there are Hawaiian and another ethnicity. So Hawaiian and white, Hawaiian and Asian. So they're very mixed when it comes to background. So that's very important to think about when it comes to schooling. So the program goal that I created was to teach the children at Kapaa Elementary School about effective daily oral hygiene habits, what the dental hygienist does, what teeth are, and how to provide them with a positive dental experience. I created some objectives that I wanted to make sure that I was meeting when I was doing my program. So that was for 75% of the children in the preschool class to be able to identify effective dental oral hygiene care. My second objective was for 60% of children in the preschool class to describe what us as dental hygienists do. And my last objective was for 85% of children in the classroom to be able to identify what healthy foods are for their teeth. That is so important. And if they can't start there with the minimum things, it'll be harder for them to build up and focus on things later. So when I did this program, I did a bunch of different activities. I was able to do a children's book every day. I talked about what a dentist does. I did informational lectures. We did coloring sheets. We did a craft. They got to hold a tooth model. They got to do Play-Doh and beans to make teeth. They did a hands-on toothbrushing demonstration, and they even got to take home a goodie bag with a little card that talked to the parents about what we were learning and what they should do to help them at home. Here you can see some of the pictures that I had given with the program and activities I did. You can see they're flossing some teeth with Legos. They did their tooth crowns, which was so cool. And then to build off of what they were learning that week, which was counting to 20, we did Play-Doh with beans to count teeth and learn the letters that go with the teeth. I did a pre and post program survey so I could evaluate what they knew versus what they learned after my program. And it started with some simple stuff, holding up objects, asking them, do you know what this is? I held a toothbrush and floss and mouthwash, toothpaste, and the majority of them knew what that was. Then I got to the harder questions and I asked them, how long should you brush your teeth? Do you floss? What does a dental hygienist do? And what are some healthy foods for your teeth? Those are just things so I could see where they were to help adjust my program later on in the week. So, very important when it comes to this evaluation is that the questions cover the topics that I plan to work on during the program. I solidified information they were taught, then helped me to see areas I needed to improve on. I did a skill check to make sure they were taking away the basic skills and they could use it at home. I did the takeaway quiz at the end to see how important implementing a program could be so that we could see the increase of students that were learning the program. And then the quiz also helped me to see the smallest difference about how they look at their teeth and show them that it can be a positive experience. Results pre versus post were actually pretty drastic when it came to the bottom half. So basically, they all knew the basic things like a water pick and a toothbrush. So that's great. You can look at the numbers there. But when it came to things like do you need to floss, not a lot of people knew before that they should be flossing, but after our program, majority of them did. And only 2 students out of 82 students knew what a dental hygienist did before our lecture, and at the end of the lecture, 76 out of 82. So those increased by quite a bit. If you want to go ahead and take a look at these statistics and data, you can go ahead and do that. And the results I got that this project was a great success. I've had many other preschool classrooms asking for that presentation to be given to their class. They enjoyed the hands-on activities. The parents loved that they got to take home a crown and they would not stop talking about brushing their teeth. There was a student that even drew a sugar bug. We did the What a Sugar Bug Is book and we watched the video and they were teaching all their family and friends all about it. And we actually did have a lot of parents that went ahead and made appointments for their kids that didn't know how important it was to start dental hygiene while they were younger. And the conclusion based on my study is that community-based educational programs and preventative initiatives are proven to give strategies that are highest helping education when it comes to people at high risk. So the students at Kapaa Elementary School were a great risk for dental hygiene problems. So this program helped give them a little building blocks to do better. And Paulson and Fass also said that active learning is, in short, anything that students do in a classroom that's just not listening to me talk. So reading the books, watching the videos, keeping them engaged, these were all things that helped them get back into and solidify what they were learning. Another thing that's Sullivan talked about is early childhood caries is the presence of one or more decayed missing teeth in a primary tooth surface among children under the age of 6. So that fits exactly where the students I worked with were. They were 3, 4, and 5 years old, and a lot of them did have active decay. So the program that I did helped to solidify the fact that caries is a risk for young kids and they need to have some type of way to help prevent this, and just having a program to help them is so important. So far, all of the data that I collected shows how much of a need there is to have this program in the state and on the island of Kauai. They need to have an educational program to help lower their risk of cavities and give them a backbone to have a healthy, happy smile and a great relationship when it comes to dental. Here are my references, and I hope that you see just how important it is to start at the lower educational levels and teaching all of the young students about how important it is. My program was a great start when it comes to the island of Kauai and the city of Kapaa, but there is so much more that can be done. So I'm hoping that by students and teachers, faculty, and even the principal seeing this program, she'll reach out and want more research to be done. She wants to have more programs created, and lots of students still, when they see me out in the world, they're like, oh my goodness, you're the one who taught me all about my teeth, and that makes my heart feel so good. Thank you for watching my presentation, and I hope you love my program.